City of Grand Rapids is increasing efforts to keep kids from being exposed to lead, and a community advocate who has spent the last 2 decades fighting to get the lead out of homes is leading the charge. News 8's Shola Fergie has our story, all new at 7.
It's an issue that lingers long after it disappears from the headlines.
Flint definitely raised awareness, and then there's been the ongoing conversations now, the recent news out of Benton Harbor. People are very tuned into the fact that lead is a neurotoxin for kids.
The kind of poisons that can lead to developmental delays, ADD, hyperactivity, and other issues in children.
It causes brain damage.
The longtime head of Get the Lead Out, the collaborative that began in 2001 that helped identify lead paint in older homes in the area and train crews on how to safely remove it, is now taking his mission to City Hall. Paul Haan was recently appointed lead program specialist with the city of Grand Rapids.
You know, I've always had an interest in environmental issues. I've also always had an interest in kids and kids succeeding in life. And this really does bring those two things together.
Haan's new job signals a more aggressive approach on the part of City Hall to dealing with lead in homes. The goal, getting lead before lead gets to the kid.
Typically in Michigan, cities are not public health players, if you will. And the city of Grand Rapids has stepped up and said, this is important, this matters to the people in our community, we've got to move on this.
Historically, neighborhoods like this in the 49507 area code of Grand Rapids have been ground zero for the lead poisoning problem, with an older stock of homes, many of them rentals. The neighborhood is bound by Franklin to the north, 28th Street to the south, US 131 to the west, and just east of Kalamazoo Avenue.
We did a lot of interventions that drove down numbers, and those things have reached their peak effectiveness. And now if we want to go further, we've got to do more. Right now we're testing about 60% of the kids that should be tested at 1 and 2 years of age. So we have an incomplete picture, but the incomplete picture we have says that we've got work to do.
Haan worked with the city during his tenure at Get the Lead Out and the Healthy Homes Coalition. His new job will help create a more strategic plan run through the city's Community Services Department.
Is it a carrot or a stick approach?
It's both.
For example, lead testing could become part of the city's rental certification process. At the same time, the city can help landlords get access to grant dollars and low-interest loans for lead abatement. Haan admits he has a difficult task ahead, but with the right partners on board, he's convinced the city can improve the health of its children.
Because the city, just can't say, wave a magic wand and say, do this. It's got to be realistic, doable, implementable. That's my job.
In Grand Rapids, Shola Fergie, News 8.